Anemia classification. Today our lecture. Prepare your notes and pencil, and next class I will check you. Anemia is a pathological, clinical, and hematological syndrome which is accompanied by a decrease in the content of hemoglobin and red blood cells in the circulation blood. Hemoglobin containing blood in normal condition and with anemia, and we can look and from 6 months to years inclusive normal level hemoglobin and more than 110 gram liter. Children 5-11 years and more than 115. Children 12-14 years old, more than 120, women from 15 years old, more than 120, pregnant women more than 110, man from 15 years old, more than 130. And also we have anemia stage, mild anemia, moderate anemia, and severe anemia. And by ages, this number changing. And look, mild anemia and moderate anemia, I will ask. Blood color index shows the degree of saturation of the red blood cells with hemoglobin. Normally it is 0.86, 1.1, both in men and women. Depending on its following anemias is distinguished. We have hypochromic, normalchromic, and hyperchromic anemia. And this means how much level hemoglobin level in erythrocyte. Before number blood color index, and we can put diagnosis this which type of anemia. Okay, now we are telling about hypochromic anemia. This is means less than blood color index less than 0.86, and hypochromic anemia classified by two: iron deficiency and thalassemia. If you general blood test, you're looking blood index less than 0.86. This is hypochromic. Normalchromic anemia, this means blood color index 0.86 and 1.1. And this is classified by 6 types. First, hemolytic anemia, second, post-hemorrhagic anemia, third, neoplastic bone marrow disease, fourth, aplastic anemia, fifth, extramedullary tumors, and sixth, anemia due to decreased production of erythropoietin. If you're looking normal chronic anemia, and we need research these six disease. And hemolytic anemia means when the rate of destruction of red blood cells exceeds the rate of their production. Okay, next time we are speaking hyperchromic anemia. Hyperchromic. This means blood color index less than 1.1, and this classified 3 types disease. If your patient have hyperchromic anemia, and we need research vitamin B12 deficiency, folate deficiency, and myelodysplastic syndrome. And next, according to the ability of bone marrow to regenerate, and we have 4 types: regenerative anemia, hyporegenerative, and also normal regenerative anemia, and hyperregenerative anemia. The main signs of such as regeneration is thus increasing the number of reticulocyte, young red blood cells in the peripheral blood. The norm is 0.5 and 2%. What is mean regenerative anemia? This means reticulocyte absent in general blood test. This means reticulocyte not producing. Hyporegenerative, if your patient reticulocyte less than 0.5%, and normal regenerative, this means if your reticulocyte in general blood test normal 0.5 and 2% between. Hyperregenerative, this means more than 2%. Okay, in pathogenetic classification, classified 6 types. First, iron deficiency. Second, dysmetapoietic anemia. Third, post hemorrhagic anemia. Fourth, hemolytic anemia. Fifth, B12 deficiency anemia. And sixth, folate deficiency anemia. And we need now pathogenetic, and iron deficiency means iron not enough, yeah. And Post-hemorrhagic means associated with acute or chronic blood loss. Hemolytic, this is associated with increased destruction of red blood cells. And the B12 deficiency associated with impaired DNA and RNA synthesis. And the dysmetapoietic anemia associated with impaired blood formation is a red bone marrow. And by etiology, anemia in chronic inflammation situation, we have anemia after infection, anemia after collagenesis, and anemia after megaloblastic anemia. And this is by etiology anemia in chronic inflammation process in the body for patient. Okay, next we need speaking for infections. This means tuberculosis, bacterial endocarditis, bronchiectasis, lung abscess, brucellosis, pyelonephritis, osteomyelitis, and mycosis. And first time this patient have chronic this infection disease. After, for complications starting this patient anemia. For collagenoses, this means this patient have chronic systemic lupus, erythematosus disease, rheumatoid arthritis, polyarthritis nodosa, Horton disease. And after this disease, for complications starting this patient anemia disease. And do you know any people with chronic disease who have anemia? Okay, and next type of this is megaloblastic anemia. Have two types. First, pernicious anemia and hemolytic myocarditis. And after this chronic disease, more time starting megaloblastic anemia. Okay, thank you so much, and next class I will check. Bye bye.